So that's a great question. Now, with the advent of moving all of our therapies we're using second line up into the front line, is how do we manage these patients who don't respond? Because even with the impressive response we've seen, unfortunately, there's still patients who have progressive disease, better respond, or respond and then relapse. So we actually looked at this retrospectively at cabozantinib in this setting. So in the pivotal METEOR trial, very few patients had received IO therapy prior to receiving cabozantinib. And what we showed was that independent of prior IO therapy, cabozantinib was a well-tolerated regimen with comparable response rates. So cabozantinib is certainly an option after IO alone or after IO with TKI. And then beyond that, I think we're obviously looking at clinical trials. So there's ongoing trials exploring cabozantinib with HIF-2 inhibition or glutaminase inhibitor, really trying to look at ways to further improve our therapies. And it's something I think we need to continue to do, because while these trials we have are certainly very exciting for our patients, they're not 100% effective. And so continuing to look for new therapies is going to be important to advance the field.